My heart doctor thought I was nervous. Well, I said, I'm never nervous. So he took, well, as I was laying down on the table, he said, you're nervous. Well, you gotta be nervous, but I said, I'm never nervous. So that's where the Chorea first started.
We've been married almost 40 years. It'll be 40 years next month. And so we've always been close and worked as a team. And it hit us both pretty hard when we found out that Harry did have Huntington's. When Harry first started taking Xenazine, his movements were very slight. You know, we didn't know what it was, but the doctor explained what Chorea was to us. And he presented to us a medication that he said he thought would help Harry's movements. And Harry decided, yeah, let's go for it, let's do it.
When patients first come in and we discuss treatment options for their Chorea, one of our goals is to make sure that they're educated, that they understand that the medication is not a cure, it is a treatment of their symptoms, and that we may get good care, good Chorea reduction, but it won't get rid of it completely. And typically we start very low, go slow, and watch for side effects. Some of the side effects that we need to discuss are contained in the black box, which is the depression, the increase in depression, possible suicidality, and then the more common with sedation, sometimes insomnia, sometimes fatigue, those kinds of things that we have to really watch for. But as we get higher doses of the medication, we do a blood test called a CYP2D6 test, which looks at how you respond and how your body is processing the drug.
Patients should also be counseled to be on the lookout for other serious side effects seen with Xenazine, as noted in the important safety information at the end of this video, or in the medication guide and prescribing information, which is available on xenazineusa.com.
As we got into a longer time period with him having the Chorea, the doctor was experimenting with dosages. Sometimes it wasn't enough, sometimes it was too much, and it did take a while to settle on the dosage that was right for Harry.
With any treatment that's prescribed by your physician, before you change a dose, before you stop a medication, it's important to talk with your healthcare provider. There may be ways that we can change the dosing, things that we can do to alleviate some of the side effects, but we need to know about them. So it's important that you communicate with your healthcare provider with any change that you may encounter.
During your first visits, you're pretty intimidated, you're frightened, you're uneasy. Talk it over before you go in to see the doctor. Have a list of questions. Sometimes when I go in, I just go blank. So I have questions. We've talked about what we wanted to ask. I've actually written them down and gone down the list of questions that I wanted to ask the doctors, and that's helped a lot.
Huntington's disease is an ongoing progressive illness. So your symptoms may not be the same the day you're diagnosed as time goes on. So it's important to maintain dialogue with your healthcare provider about the changes in your symptoms and about how your treatments are reducing those symptoms.
It's very critical to stay in touch with the team, because as you go down the path with Huntington's, you don't really know what's ahead of you.
Xenazine tetrabenazine tablets. Indications and usage. Xenazine is a medicine that is used to treat the involuntary movements, chorea, of Huntington's disease. Xenazine does not cure the cause of the involuntary movements, and it does not treat other symptoms of Huntington's disease, such as problems with thinking or emotions. It is not known whether xenazine is safe and effective in children. Important safety information. Xenazine can cause serious side effects, including depression, suicidal thoughts, suicidal actions. You should not start taking xenazine if you are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings, or worsening depression. This is especially important when xenazine is started and when the dose is changed. Do not take xenazine if you have liver problems or are taking monoamine oxidase inhibitors or reserpine. Ask your doctor or pharmacist if you are not sure. At least 20 days should pass after stopping reserpine before starting xenazine. Tell your doctor if you are pregnant, breastfeeding, or have breast cancer. Do not start any new medicines while taking xenazine without talking to your doctor first. The need for therapy should be evaluated on an ongoing basis with your doctor. The dose of xenazine should be adjusted slowly over several weeks for a dose that is appropriate for you. Tell your doctor if you stop taking xenazine for more than 5 days. Do not take another dose until you talk to your doctor. If your doctor thinks you need to take more than 50 milligrams of xenazine each day, you will need to have a blood test to see if a higher dose is right for you. Neuroleptic malignant syndrome, NMS, is a potentially fatal side effect reported with xenazine. Call your doctor right away and go to the nearest emergency room if you develop these signs and symptoms that do not have another obvious cause: high fever, stiff muscles, problems thinking, very fast or uneven heartbeat, or increased sweating. Xenazine should be stopped immediately if NMS is diagnosed. Xenazine can also cause other serious side effects, including Parkinsonism, slight shaking, body stiffness, trouble moving or keeping your balance, restlessness, akathisia, trouble swallowing, irregular heartbeat, and dizziness due to blood pressure changes when you change position, orthostatic hypotension. Trouble swallowing may increase the risk of pneumonia. Uncontrolled movements called tardive dyskinesia, TD, may also develop in patients treated with xenazine. It is possible that the TD will not go away. Side effects such as irregular heartbeat, NMS, and Parkinsonism may be increased when using xenazine with other drugs, for example, dopamine antagonists. Sleepiness is a common side effect of xenazine. Do not drive a car or operate dangerous machinery until you know how xenazine affects you. Alcohol and other drugs may increase sleepiness caused by xenazine. Some side effects, such as depression, tiredness, trouble sleeping, sleepiness, Parkinsonism, agitation, and restlessness, akathisia, may be dose-dependent. If the side effects don't stop or lessen, your doctor should consider lowering the dose or stopping your xenazine. The most commonly reported side effects in studies with xenazine were sleepiness, trouble sleeping, depression, tiredness, anxiety, restlessness, agitation, and nausea. For more information, please see the full prescribing information, including boxed warning, the medication guide, or go to www.xenazineusa.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.